So we are here for an Instagram live session on what are the queries of beginner homeopaths or any homeopath who is in the follow list. What are the difficulties for homeopathic practice? And we circulated a question, uh, in the story, and I got a few responses. Meanwhile, good to see Nanda Archana 23 and Ahalya. Uh, if you wish to ask any queries, and we are live on Instagram and YouTube together, so if there is any query which anyone feels to be answered, to be asked for case taking, repertory, materia medica, potency, repetition, anything you feel like, you can drop in your questions. So I will answer from whatever knowledge I have, whatever experience I have, and if not, then we can always get back in different form on social media. So few queries that I received. Let us go through the few queries. Potency in acute cases. Many beginners, many homeopaths have this question: what should be the potency in acute cases? As a beginner, if you are sure that this person requires, has actually from the case taking itself, right? From the case taking itself, you know that this person has something which is very peculiar, like the restlessness of aconite, right? We read in homeopathic materia medica keynotes. So that restlessness we can find out from the patient, and if we feel that this mind is very striking mind symptom, or this restlessness of this remedy is very striking also, then we can probably start with 1m or 10m. Best is to start with 10m, but sometimes the beginners feel that it's too high, it's going to explode in the body, or cause an aggravation. Nothing like that happens. If you are confident of the remedy, 10m is the one to begin with. If not confident, 1m is the one to begin with. Next question is, what is the approach of treating G6PD? Interesting. There is no approach. You do not treat it. There are some restrictions you need to follow, and it straightens out itself over a period of time, or it remains the same. The immunity, vitality may be weak. You can treat the patient according to the symptoms that come up. There is nothing that we can do to reverse it or improvise it. If you know of any homeopath who probably gives you the right approach or the right method or right answer, maybe you can feel free to share with me also, so that I can upgrade my knowledge. But as far as I know, and I have dealt with in such patients in the last 15-20 years, there is nothing as such that you can do, because it's a gene which is got changed or is missing. So there is very less you can do. So glad to see Prabha hello and Yadav Neha in this Instagram live. It is about difficulties in homeopathy practice related to case taking, materia medica, repertory. And okay, we are answering one question which is about treating G6PD. So according to homeopathy, should we also avoid sulfur and its components? Not at all. What is interesting is that G6PD, they tell you that you need to avoid some chemicals or some medicines and etc etc. The best part is that in homeopathy we are potentizing the medicine, and the potentized medicines, those who even have sulfur allergies, they can actually be given sulfur as a potency, and it will not cause any aggravation. You can try it out and see, it does not cause any aggravation. And to G6PD patients especially, you can beautifully get good results with sulfur as a potency if it is indicated. That is the all conditions apply always in brackets. But You have to understand that when homeopathy medicines are potentized, you do not worry about it if it is indicated for the symptoms indicated and symptoms which are mentioned by patient or objectively seen by the physician, you can definitely prescribe it. So we are in this session and newcomers, many newcomers, Dr. Vidya, Nitya, Janish Sheikh, etc. I would like to inform everyone, and there are few followers on YouTube also. We are live on both the platforms. What are the difficulties of homeopathic practitioners related to case taking, materia medica, repertory, potency, reputation? And if anyone has any query, please feel free to ask so that I can answer best from whatever knowledge or whatever cases I have seen with other homeopaths, with my own practice, or from my own book reading of different authors. Meanwhile, we'll go through a question which was circulated in the story, and there are a few questions I got in writing from my team. So, there is a mention that in cases of polyp, what should be best done? So, does it give result or no? The first dilemma of a homeopath is whether the polyp will come out or whether it will be melted inside, like molded inside the mucosa. So if the medicine is accurately strong enough and similimum, it will definitely release the polyp from that place. At times, if it is too small, it will go with the nasal mucosa and bind well with it. But treating polyp only with constitutional is going to be tough. You will need to give intercurrent medicines. You will need to give remedies like Teucrium marum varum. It can be intercurrent medicines such as sulfur or even those medicines that act on the nasal mucosa. All it can be allium cepa, it can be those remedies that cause these psychotic indurations, thuja. So all the psychotic medicines you can think of and give it intercurrently with the different medicines that you are already giving. It can be constitutional, it can be biochemic, but try to focus on medicines which are in potency 6 onwards, 6, 12, 30, 200 and so on, rather than on biochemic, because biochemic will mostly work at the tissue level and you will need to give large doses of it over a period of say 2-3 months to see good effects, or in chronic cases especially. So that's about the second question. First question was about G6PD deficiency. How can we deal? How can we handle them? Can we give sulfur drugs to them? Sulfur as a potency, will it cause any problem? And the second was how to treat polyp and what should be our mode of treatment. So I'm doing this session of Guruvar Gyan, which is some cases from my own practice, and the upcoming session is on 17th in the evening between 5 to 6:30 or 6:15, 6:30, around 1.5 hour. And those who wish to learn about how to treat ringworm, how to treat cough, fever, pharyngitis, when to give nosode. There was an interesting case of nosode which I prescribed. And interestingly, what should be the time, especially in acute cases? There was very less time. The patient was having red spots all across the throat, and I gave the medicine. The patient relative told me that we have given the medicine for 12 hours and it's now 1 day almost, it's not working. What should you do? Should you switch gas to give higher potency or no sod? That's what you will find in my session on 17th October. Meanwhile, we are doing this session Instagram live today for everyone to answer their questions about homeopathic practice or what are the difficulties in case taking, repertory, rubrics, materia medica, potencies, repetition, etc. etc. Two questions we answered about G6PD, and second one was about polyps. Let's go over through the third question. The third question says that in eczema, when can we stop the ointments which the patients are taking? So very nice question whoever has asked, and it's a challenge for a homeopath to taper off the allopathic medications that are going on. It can be a simple thing such as ointment for the skin or nasal drops for the nose block patients. It can be allopathic medicines which are required for them to be taken. It can be blood pressure, it can be diabetes and what not. So this should be a generalized question for all the homeopaths rather than a specific condition which someone has asked, that what should be or when should we stop the ointment in eczema cases. Now this is question number 3. When should we stop eczema in ointment in eczema cases? So you should first see how much the patient has applied so far and what is the frequency of his applying those medications. Is it on regular basis, every day, every alternate day, or twice a day, and how much your medicine is working. Once you start giving medicines, you will have to keep them on the medicines for some time. It will not be something constitutional given one dose and waiting for 3 months or 6 months. That's not going to be your approach in worst cases of eczema. You will need to you know give it intercurrently some other medicine, miasmatic. You will need to give the same medicine in water maybe every 15 days, every 1 month. And more importantly, after you started the medicine, what are the changes in the skin? How much is the dryness? How much is the irritation, itching? If they are applying cream every twice a day, every day twice, then you can taper it off to once. So best method to do this is to taper off. That is the first thing I would suggest. Second thing is that how much is the patient's vitality or how much is the patient's life organs are dependent on that medication. So it can be that he's taking ecosprin and he's dependent on it, or there is some platelet problems, he's dependent on that medication. In those cases, definitely you can continue it. But if you feel that medications are doing well, your homeopathic medicine is doing good, you can probably stop or kind of taper off and then stop. It's a challenge, but more discussion over this can be had in sessions which I keep on doing. Those who wish to join, they can definitely join. One of the sessions that I'm doing on upcoming Thursday, which is 17th of October, which is day after tomorrow, is on ringworm. And it was a very severe case, worst case of ringworm. She had applied everything, and how she improved and what should be our approach. This is one of the toughest challenges for homeopath. So it takes me to the next question, and next question says that what should be our approach in skin diseases? Should it be constitutional? Should it be specific? Should it be rare remedy? This dilemma will always exist for all types of homeopaths, and I am decoding this part of what medicine to be used. Should it be constitutional? Should it be specific? Should it be rare remedy in the session on 17th October? It's a case of ringworm. For example, I'll give you an example just to give you a glimpse. More details are definitely kept for the session on 17th October. The patient of ringworm had already applied lot of creams, lot of allopathic had taken, and it was getting very worse. It was near the hair. She was a girl, in fact a doctor. Now when they know the limitations, they approach homeopathy. When you have such patients who have done everything they could and they fail, they will naturally depend on you for everything that is happening with them. But What will be your protocol to treat such cases? Should you give constitutional? Should you give specific? Should you give rare remedy? Now, this is actually dependent on the case, and every case will require its own methodology. So, what should be the protocol? When will you veer or navigate towards specific medicines? When will you navigate towards rare medicines? When will you navigate towards constitutional medicine in cases of skin diseases? You can give whatever medicine you are giving, like say sulfur and calcarea or phosphorus, give one dose and wait for how long will you wait? 1 month, 2 months? Patient is not improving, and you have attended all the seminars, rare remedy seminars and rare remedy Instagram lives and Facebook lives, and it is still stuck up. The patient is not improving, and all your knowledge is gone in dustbin. So on the 17th of October, I am decoding this part where you will understand how will you deal with such patients, especially skin diseases, especially ringworm specificity. That when will you give constitutional, how long will you wait on the constitutional, when will you give specific medicine, when will you give rare medicines. That is a big challenge for a homeopath, and once you understand those protocols, those methodologies, you will be able to deal with such patients easily. You will be able to answer their queries. How much time will they take to improve, when will they not improve, etc., etc. So those things are there in the session. Those who wish to join, they can join to understand how you can understand and decipher these cases which are practically needed to be solved, whether to give constitutional, whether to give specific remedy, etc., etc. So that brings us to the four questions, and last question I will answer now and we call it a day. We answered already four questions. One is question on G6PD, what to give, when to give, or should we give or should we not give. Those who are joining late, Dr. Shreya and Dr. Avadhish, Dr. Lichi, Shushti, etc., etc. I don't know if anyone is online, and few viewers on YouTube. Uh, One question we discussed was about G6PD. You can watch it again. The live will be kept on the feed. Next question was about polyp. Third was about eczema and ointment. When should we give ointment, or how long can we keep patient on ointment and remove from the ointment? And fourth was on ringworm or skin diseases, constitutional or specific treatment should we give. Last question what I have from someone is that, okay, we'll take up this one. Mental diseases. How to handle patients who are psychiatric and how do we deal with it? So, psychiatric patients are already under medication from some psychiatric doctor, or they already have been meeting their physician or whatever. Mostly they can meet either of them, and they have medications which are going on. It can be a case of maybe bipolar disorder, it can be a case of schizophrenia, etc., etc. The idea is to give them short doses of those specific medicines. For example, there is a case of depression whom I was giving phosphoric acid for a very long time. Very long time means that almost 10 years. And he kept on improving, but he kept on complaining, never improved. I just gave him few doses of serotonin and the result was remarkable. So you will need to give these short acting medicines which will stimulate their brain to go towards positive thoughts and do things which are positive. And this patient, after taking serotonin, he stopped coming for you know few months. He didn't require to take medicine every frequently, and he told that he keeps on doing much better. He's lively, he's active, he's not feeling depressed. And the medicines, phosphoric acid also did its job, serotonin also did its job, and he is much more hale, hearty, and happy. So, in mental cases or in psychiatric cases, what you'll need to do is you can give your constitutional medicine, give it in varying doses. Don't give one dose and wait for 2 3 months, 6 months. Give the second dose after say 30 days or 25 days, and give it in varying form, like the same medicine in water for a couple of days, or the same medicine in plusing potency, something like that. Every case will need its own yardstick. So that's what you can do, and more details if you wish to learn from my different courses, different sessions. There was session done on case taking rubric workshop, which is about how to take the rubrics, how to convert patient language into rubrics, how to understand different kingdoms, and fever workshop. We did this four workshops and renal calculi workshop. All the recordings are available. Those who wish to avail the recordings, they can definitely contact my same Instagram channel ID or YouTube. They can mention in the comment and we'll contact them. And one session which I am doing on the 17th October is about ringworm, constitutional or specific medicine to be given, and a case of cough, fever, pharyngitis, which will be taken up. So those who wish to join to learn about different aspects of repertory, rubrics, materia medica analysis, when to choose remedy, how to choose remedy, how long to give certain remedy and switch over to the next remedy, especially in acute cases, it's a challenge. Those who wish to join, they can join this session. And we call an end to today's Instagram live. We took about five questions: music, speedy, eczema, and something about ointments, when to apply, when not to apply, and last but not the least, about the prescription of constitutional or specific remedies in skin diseases and whatnot. So we call it a day, and those who wish to avail any recordings or join upcoming sessions, they can contact my team.